Question I hear a lot, and I think is a very important question, is what to expect after surgery in terms of swelling, healing, and exercising. And I have a diagram to help explain that. So this is a very simplified diagram of healing after surgery. And so this direction is the swelling to expect, and then this is the time. So if we start on the day of surgery, there's going to be some early bruising and swelling that first few hours, and then it usually peaks out around 3 to 7 days after surgery. So that first week, patients can expect to look a little messy. Then we transition into this period where the healing gets really favorable in terms of the swelling goes down rapidly. And this rapid phase of healing is for the next 3 to 6 weeks. So when I see patients back around 4 to 6 weeks after surgery, they're looking pretty good. Then we're going to segue into this slower part of the healing, usually around 6 weeks to about a year, and that's the slow remodeling process of the healing. And it can be a little bit frustrating for some patients because if you're having a little swelling that's related to the surgery, it's almost like watching paint dry. It's a little bit slower in terms of it resolving. So we have to watch patients out a year to get a good assessment, but this is a typical timeline. So the reason why we have patients hold off on doing any strenuous activities after surgery is because the activities that cause increased heart rates, blood pressure, resistant activities can drive this curve back up in the healing. And so that can delay the process and add more swelling and potentially scarring that we don't want. So that's the reason why we don't want patients to exercise, is to push this curve out and delay the healing. So that's the reason why we have patients hold off on doing anything too strenuous that first few weeks after surgery.